Hello everyone and welcome to Module 2. We've gotten through the first module, so you should have a good idea of how the course works logistically. Each module will basically be structured just like the first one. For Module 2, we're discussing cardiovascular medications as well as renal and genitourinary meds. These systems are really interconnected, and some of the medications you will learn about work in both the cardiovascular system as well as in the kidneys. So let's take a quick look at the topics for Module 2.
Okay, so the topics that we will be covering for Module 2 are the cardiovascular system and the renal and genitourinary system. Let's start by taking a look at the topics in the cardiovascular system. The drugs that we're going to cover in the cardiovascular system include ACE inhibitors, digoxin, calcium channel blockers, statins, niacin, bile acid sequestrants, fibric acid derivatives, anticoagulants, and methyl-dopa. For all of the drugs listed, you're going to want to make sure that you understand the indication. So when is that drug prescribed? The mechanism of action. How does that drug work for what it's prescribed for? So how does it work in the body to treat the symptom or cure the disease? The onset of therapeutic effect. When does that drug start working? What are its significant adverse effects? So you don't necessarily need to know every single adverse effect possible. You want to know the significant ones. And those significant adverse effects are going to be covered in the videos or covered in the PowerPoint lectures. Same thing for the contraindications. You don't need to know every single contraindication for the medication, but you do want to know the significant contraindications. For instance, ACE inhibitors given with diuretics increase the risk of hyperkalemia. That is a significant interaction or contraindication. Evaluation and follow-up. So how do you know that the drug is working, and when do you want to follow up with your patients to make sure that the drug is working? For the conditions that we're going to cover in the cardiovascular system, we've got angina, hypertension, congestive heart failure, hyperlipidemia, and DVTs. For these conditions, you're going to want to know the first-line therapy. So what is the first-line medication or treatment for the condition? Well, how should you educate patients with that condition in regards to the pharmacotherapeutic and non-pharmacotherapeutic treatment plan? How do you monitor those patients? Are there any labs that need to be drawn if patients are on medications to treat these conditions? And when do you follow up with your patients? So that's cardiovascular. For renal genitourinary, the drugs are alpha-adrenergic antagonists, 5-alpha reductase inhibitors, PDE5 inhibitors, musculotropic relaxants, and diuretics. Now, diuretics are used in the treatment of chronic kidney disease and some other renal things. They're also used in the treatment of hypertension. So that drug class kind of goes with both systems that we're discussing this week. The conditions that we're going to discuss are benign prostatic hypertrophy, erectile dysfunction, and urinary incontinence. And again, you want to know first-line therapy, patient education, what are you monitoring in those patients, and when are you following up with those patients? So if you have any questions about the content, about the topics list, about the content, about any of the videos or lectures, please make sure you post them in the Module 2 questions and answers forum, and I will be sure to check that often. You can also email me, but I would highly encourage you to post in the questions forum. All right, have a great week, and I will see you next time.